All right, so for those of you that might not be able to see the chat, we had some challenges this morning where our CART interpreter for closed captioning became unexpectedly unavailable to us. We understand that it's important to make accommodations available through closed captioning, and that is not an option through this Zoom license that we have available to us for this meeting. So our plan is to have Maureen take detailed minutes and make them available after, but certainly if anybody is opposed to us moving forward with the meeting without the closed captioning, we can cancel today's meeting. So if there's anybody that would like to cancel, just let us know in the chat, or maybe let Alicia know in a private chat. We want to make sure that we're certainly accommodating everybody. Okay, there's Stephanie. All right. So I think we can go ahead and get started. We're already 11 minutes in, and we have a lot to cover today. So welcome, everybody. Thank you for joining us. I'm happy to be here. My name's Sandy Hunt. I'm the Bureau Chief at BDS. I think I know most people here. And Nancy is unable to facilitate today, so I will be facilitating instead of Nancy. So this is meeting number 3 of our steering committee work, and we're gonna start moving through the slides now. I'm not going to worry about introductions because I think by now everybody knows each other. So the goals for today's meeting are clearly outlined here. We want to give an update on the 2 work groups, which include the waiver work group, the rate setting work group. We want to talk about the assessment tool details, uses, and next steps. I know that there were a number of documents for folks to review after the last meeting. And we want to receive the feedback from the steering committee about the timeline that was also sent out after last month's meeting, which aligns the corrective action plan work with the BDS systems work. Of course, this work group is open to the public. Any members of the public who are not on the committee can listen in and can certainly email us any questions or comments to the email address that's up on the screen here. Next slide, please. So we're going to go over those report outs. We're going to talk about the assessment tool clarification, the timeline, and then we'll have an opportunity to take any questions. Oh, excuse me. This is the agenda for the 11/18 meeting. So this is the waiver work group agenda. So we went over the timeline at that waiver work group.
Actually,
so next. Yeah.
Sorry, Sandy. That's
Thank you, Alicia.
So here's the summary of the waiver work group, which is the first item on the agenda.
Okay, I appreciate that clarification. Thank you. So, well,
there are still some links. This is Lisa Bodwin.
Hi, Lisa.
And I apologize. Hi, good morning. I think that there are still some other balcony level clarifying questions that have been posed a number of times that are still a bit unanswered. And I wonder if we can ask some questions about the process first and get a little clearer about that before we jump into questions on what's being reviewed.
Okay.
I know that Kathy Spinney has some questions that she would like to ask. I have a couple of questions as well.
Sure.
You want me to go, Lisa?
Sure.
My first overarching question, which I haven't been able to get an answer to yet, and Sandy, you may not be able to answer it either, but somebody's got to answer it at some point soon. Okay. And I actually sent a list of questions to Nancy yesterday, and this morning I hopefully forwarded them to everybody in this group. So in your email, I'm hoping you have an email from me with these questions. But the primary question I am still very foggy about is who is behind this initiative? Who woke up one day, and it is a who, okay? there's names. Who woke up one day and said, I have a great idea. Let's hire this outside company and shake everything up. I don't know whose idea this is. I don't know why they got this idea. Where did this idea come from? And I still don't know what the goal is. Is the goal to spend less money? Is the goal based on our historical values of the system to really ramp up and spend more money and get it done really the right way? New Hampshire's always in the top 5. Let's get to number 1. Like, I don't know those answers. And those answers directly correlate to my ability to know what I'm being asked to do. And I don't have that. And I don't know if it's just me. It could be just me. Yeah. But I would like those very basic questions. Whose idea was this? Why do they want to do it? And what is the goal? What is the desired outcome? And whoever that person is, I'd love them to come and talk to us. Is it the governor? Is it the, Speaker of the House? Is it the commissioner? I don't know, because who it is feeds my understanding of their background to even make these decisions in the first place, which also affects my participation. So that's the big one. And then hopefully all of you got those lists of questions I sent to Nancy, and I don't expect all of them to be answered certainly today, but I would like them answered, perhaps in the next meeting or two. So Sandy, you were CC'd too, so you should have them at some point, and nobody's had time to review them, so I don't expect anything today. But we really need that. We need to know what the heck we're being asked to do.
Okay. So I appreciate you giving us time to respond to the questions and not have to give you a detailed answer this morning. I do, however, think that once we get to the timeline at the end of the presentation, that will help provide some clarification on the why of this whole initiative. And I think part of the confusion is that we started out with the corrective action plan, and we did a very detailed campaign across the state talking about why we were on a requirement from CMS to basically come into compliance with conflict of interest requirements, which then led to direct bill and rate development. So those are some pieces that are kind of captured in this initiative that were already in play. So that's the first piece. The second piece is that we have the A&M recommendations that were commissioned and made for the entire state of New Hampshire. And we're looking at all areas of DHHS, BDS being one of them. And so we see this as an opportunity to have resources to improve our system. And nobody's saying that the existing system is bad. There is actual requirements from CMS saying we are not in compliance and that we need to become into compliance, right? So we're going to move into compliance. We're going to update our IT systems, which I think everybody agrees are outdated. And while we're doing this work, and while we have A&M at our disposal and resources at our disposal, let's take a look at what we're doing in the state of New Hampshire through our waivers and how we can improve that. Because agencies are doing lots of amazing things. And I think when you hear the report out from the waiver work group, you'll see some of the great ideas that are coming up around how we can improve our DD waiver through building out a tiered waiver approach. So there's a lot of, I think, different levels to your question, Kathy, and I certainly want to have a more succinct answer for you. But just off the top of my head, that's my initial response. And I hope that provides some clarification. Any other question? I know, Lisa, you had something that you wanted to add.
Yeah. If Stephanie and Denise have follow-up questions, I'll wait if their questions are based on Kathy's comments. I do want to remind everyone that Jonathan Ruthier asked nearly the same questions already. So I want to know if, Sandy, you and your department can deliver the answers in January, because this is not the first time that this type of questioning has come up.
Right.
So if your office can commit to that, I think we will all begin to feel much more comfortable from a balcony level, and I'll wait to ask my questions.
Okay.
I mean, I do have a follow-up, but Denise, did you have a follow-up question?
I mean, I guess after last meeting, and I think folks actually expressed their feelings. If we are the steering committee, then we guide the system. But last meeting, it seemed like a lot of things had already been decided. And so I was a little taken back with all that. So are we, I'm going to try to say this delicately, are we just rubber stamping all of this? Because then I don't feel warm and fuzzy.
So we have to meet, we have to cross the finish line on these initiatives. And the 4 initiatives are very clear in the recommendation document, right? The IT, the tiered waiver, the rate development, and then ITS capacity in our state. Those are the 4 things we have to cross the finish line on. The role of the steering committee is to advise how we get there and how we do it well. And so we're asking for your guidance on how we get there. And so the 2 work groups are discussing things in a very detailed way. And if you look at the waiver report out that's up on the screen, this is a decision point, for example, that we are going to be asking the steering committee to make today, a question that came out of that work group. And that's the goal of the steering committee, is to guide us on our path to crossing the finish line to those recommendations.
Yeah, I mean, I just will say, Denise, are you finished? I don't want to jump ahead of you.
Yes, ma'am, I'm good.
Yeah, that doesn't seem like what's actually happening. I have no confidence that the steering committee is guiding BDS in any of their decisions. I think that the idea that you are going to do all of this because you need to be in compliance with CMS's recommendations is false. This has gone so much further than the activities that have to happen, which I think needed to happen to comply with the CMS requirements regarding direct billing and conflict-free case management. I am particularly concerned about the whole idea that you guys have already decided that you're going to do a tiered waiver, because there was no discussion about that. I don't understand why we need to have a tiered waiver unless you're going to decide you're going to limit services for people in ways that you haven't done in the past, or you're going to have a waiting list for services. I mean, these are the reasons that you have 2 different waivers, because you want to be able to use one to limit services in a way we don't do now, or because you want to be able to set caps on services. And unless you, I mean, there's no reason to even do that if people can move freely between one and the other in the way that they could now. Whereas if you need a lot of help for a couple of years, you can get a lot of help even up into residential services. And if you don't need a lot of help, you can move back down so that you're getting services before. So like even that concept, which apparently has already been decided, has never really been talked about or articulated that I've heard.
So I
if
would recommend that
they're the ones who made the recommendation. Can they talk about why they think we have to have this?
Well, I think what I'd like to do, Stephanie, is, I mean, your question's important, and I want to make sure that we get you the answers that you need. I think part of today's presentation might help answer some of those questions, because I think you'll start to see how that group is working together to take a look at how we can improve services for people that receive waiver services in New Hampshire. There hasn't been a discussion of caps. There's a lot of, I think, assumptions happening that maybe once we get through the actual information, it will give you a little clarity, and then we can go from there, if that would be helpful.
Can I jump in just for a quick second there, Sandy, though?
Yeah, sure.
I do think you've asked some really good questions, Stephanie, and I agree, right? There have been instances where states have used the supports waiver because they have a wait list, right? And it gives access to a lower number of services, and it gives the ability to give people something without giving access to the bigger waiver. That's not what our intent in the recommendation was here. That is not, I think, the intent of what the state has said they want to see happen with this. So supports waivers can happen in a couple of different ways. So you can cap supports waivers, or you don't have to cap support waivers. I think what the intent here is, and what we see more states, especially states that are more progressive like New Hampshire, using supports waivers to try to accomplish, is how do we use the waiver structure to build out a more enhanced kind of, I would call, intermittent support system for folks who are not using comprehensive 24/7 wraparound supports, but have access to enhanced flexibilities that you can get through that supports waiver structure. And so Sandy's right. I mean, the conversation that I think, if you had its opportunity to listen into the last waiver work group, or if you have the chance to go back and listen to it around looking at services that would fit into either of those waivers, or to both waivers, or to one unique waiver, I think you'll see where that conversation has started to go, where it's not about how do we use the supports waiver structure to limit access, but how do we use that supports waiver structure to help people access more of those community-based and family support structures, I think, a little bit more actively and effectively through a waiver program. And from our experience, and I'll just be very transparent in why we put this in the recommendations. What we've seen is that when states are operating one waiver with all of this on there, it becomes two things. One, it becomes very overwhelming because you now have a waiver that has 40 services on it that people are trying to delineate between. And we've not seen that be successful for people in making their selections of their services. And so we've seen it more successful as splitting those into a supports waiver and a comprehensive waiver for the case management structure, for the plan development structure, so that people feel like it's more approachable. The other piece is we've seen that if all services are on one waiver, even if people start kind of with what would typically be supports waiver services, they start to really kind of build up and start accessing more comprehensive, more wraparound supports. And I think the intent of a supports waiver structure in this nature is to really help feel like people have that wraparound supports waiver structure without having to go into some of those more comprehensive supports. And so, yeah, I think that there's a misconception at times around supports waivers that it is meant as strictly as a constraint. And I just want to tell you, from my perspective, that's not our recommendation here. Was not as a constraint, but was really around how do you build that structure so that, you know, it's meeting that intent of giving people access to the right services, and to the degree possible, less of the provider operated comprehensive support structures and more around that family support structure.
But I mean, you just said, so you are limiting people's access to comprehensive services that they may or may not need. I mean, so that's.
So typically, right? So if both of these waivers were the exact same, then it would be, you know, why would you have it? So what we want to, and I think we've heard very clearly, and we completely agree, and this is where the IT comes into this, is what we don't want to see, right, is if I am on a supports waiver, it should not be complicated for me, or it should not be bureaucratic for me to move on to the comprehensive waiver. So that's a function of how do we, you know, if we have this structure in place, how do we make sure that if I need something different, then I can access something different without it becoming a whole formalized process, right? So how do I move between waiver services? I think this is what the role of this group is going to be extremely important for, is thinking about what would that look like for a person if they needed to move from one to the other. Ideally, we would build the waiver structure that we see that as not a common need for folks, right? We don't want to have it to where people feel like they have to jump between waivers. We want to build each of these to support people as wholly as possible so that they can get what they need in that waiver. But then we want to have a process where if that's not happening, that they can easily transition from one to the other.
This is Lisa. I think it's a pretty strong assumption that it's going to be easier for families to access and individuals impacted by disability to access the services they need by having to work with a service coordinator to look at the different kinds of waivers to access their services, when the existing waiver has the whole menu of services, so that if a person's situation changes for a year or two, or in a crisis situation, they have exactly what they need because the whole menu is there. And and then assuming that right now families are overwhelmed in New Hampshire because of our current DD waiver structure, I don't think families are overwhelmed by the vastness of the menu of services. I think that families are overwhelmed by other systemic issues that won't be fixed by having delineated services across a tiered waiver system. But that's my comment on that. I have, I'm concerned that we are becoming a consent committee and not a steering committee. It feels as though at times that we have given consent to the 4 items that A&M delineated are the 4 must change items that to be addressed. Certainly intensive treatment services needs to be addressed and IT needs to be addressed. So, but we knew that before. We knew that before the A&M report. And my original questions asking for this question time are, what actually happened to the CAP process? Because dozens of people put 3 years of their time and energy into the corrective action planning process. And it's in my recollection of that process, the other waivers were also participating in the CAP. Do they have their own concurrent steering committee process happening, or do they have no say in what we're doing? In what's happening, I mean. So it's my understanding that CFI also had representation at the CAP planning process. Those folks did. So are the CFI and IHS and ABD people in this group, and I just am not paying attention?
No, CFI wasn't subject to the CAP. I mean, there might have been independent case management agencies that were participating because they were interested in developing service coordination for people on the DD waiver.
Right.
But the CFI waiver is not subject to the CAP. And your point about all of the work around the CAP is a very good point, Lisa, and we're going to cover that in the timeline slide. So we'll get there.
Okay, thank you.
Yeah, absolutely. So what I want everybody to be aware of is that the waiver work group for the past month have thoroughly reviewed about 100 different services that New Hampshire and other states provide on the waiver. Each participant identified which services they'd like to kind of explore, and then determine which or both waiver, whether the supports waiver or the comprehensive waiver would be appropriate for that community-based service. So they're starting out really high, looking at 100 different services. And then we'll move to the next slide, Alicia. One of the questions that came up out of the waiver work group relative to the development of services for the comprehensive and supports waiver is related to services that agencies have been able to innovate as a result of the pandemic. So as we know, we've been almost 2 years into a pandemic now where agencies have been very creative and very innovative in determining ways to continue delivering services or modifying services so that people can still have access to their communities. So one of the recommendations was, should BDS, well, one of the recommendations from the work group to bring to the steering committee is, should BDS distribute a survey to providers and families that asks the groups like what good new things they have tried since the pandemic began. So there's a list of pros and cons to doing that. And we can start with the cons. Family and providers might not have enough time to complete the survey. We hear that a lot. People have survey fatigue. People might not feel listened to if BDS isn't allowed to make some of those changes requested. So the pros would be that we would learn new information. We would learn of new service options, and we may use that new information to create better service definitions. So what does the steering committee think about potentially distributing a survey to providers and families, asking about these innovations that they may have experienced during the pandemic?
So Sandy, this is Deb Ritzy from GSIL. You know, I'm generally not opposed to surveys, but I think one of the things is for asking the question, we have to be willing to answer, to provide a service that we may not otherwise provide. If, you know, consumers come back and say, yeah, this is what I experienced, this is what I think we need to do. So I think you have to be prepared to respond in a meaningful way, in that we're not just doing this as a process of utility.
Right.
Yeah, I agree with Deb. And I think to be transparent about the feedback that you get, because there's a lot of distrust out there that, you know, BDS gets a lot of feedback and you only tell us about the stuff that actually talks about what you want to hear.
Krista, do you have your hand up?
Excuse me, I do. One of the things that I shared in the waiver group was to be sure that we included questions. It does say families and providers, and to be sure that we included questions for individuals that are receiving services, and that if a survey does go out, my concern was, how are we going to capture information from families that don't have access to internet or email, and really targeting, you know, populations that, you know, those populations and populations that might not be, you know, have English as their primary language, and really thinking about that kind of access to get that information.
So making sure that the survey is accessible to everybody.
Mm-hmm.
Good point.
And just to
Yeah, I'm sorry.
piggyback quickly on Krista's comment, I think going forward that A&M and BDS needs to be sure that in everything that goes out seeking feedback, that individuals living with disabilities must always be included, and it would be terrific if we don't have to remind A&M and BDS to include the voices of people with disabilities in the feedback that you seek.
Yeah, and I think, Sandy, just to kind of dovetail on all of that, you know, I think one of the unintended consequences of this could be the apprehension of people wanting to respond in fear of disclosing things they may have done to get through the pandemic that may be frowned upon or may not be. Yeah, so I think the intended consequences could be very fruitful, but I think the unintended consequences, I just know when we do it here at GSIL, people are afraid that the answers they give them while they're real might come back to haunt them at some point in time. And so I think that's one of the unintended consequences that you would just need to keep in mind is people's willingness to want to respond in a positive way, thinking how they're responding is going to help them positively in the future.
Sure. So am I hearing a yes on the survey with contingencies?
It looks like that we might have comments from Ann and Jonathan still out there.
Okay, okay, thank you. I'm sorry, I didn't see your hands, guys. Go ahead, Jonathan, or Ann, whatever.
I think just to kind of tie into what Deb was saying, and part of my thoughts on this is that, you know, one of the things is people feel that they weren't listened to and they're not allowed to make some changes as requested. Anything that was done, other than those that might have been able to squeak something really creative through, really was already part of Appendix K. You guys have already told us what we could and could not do.
Well, technically,
So-
you guys told us because we built the K on your feedback.
Right, but that's what I'm saying is that
Yeah.
I'm not sure time-wise whether families will understand what you're asking them. And, you know, I mean, I'm always up for feedback from families, absolutely, but I just
Yeah.
don't think what they want to ask is going to get you anything towards this project. My 2 cents worth.
Okay. Jonathan.
Hi, thanks. 2 quick things. One is, I agree with Ann. I think there's, you know, I mean, a lot of stuff has been documented already. I know PPN put together a white paper too on the ways that, you know, the flexibilities in Appendix K were really operationalized. I think, and the other point there is, you know, we're about to be sending out about 10,000 NCI paper surveys. We also asked questions in the in-person surveys about, you know, how people's experience was during COVID and, you know, whether they had thoughts. So I think when that data comes back from HSRI or well, NCI, that might be an interesting source to look at there without duplication. I think people are, you know, but they get surveyed a lot. So
Yeah. Yeah. And that's a definite
that.
concern for sure.
Yeah. Yeah. And I think I just want to underscore what Ann, another point that Ann made, which is that it's really important to be clear about where people have input and what that input is going to result in. And I just sort of want to acknowledge the incredible amount of what appears to me to be frustration, anger, you know, with how the process is rolled out as an opportunity to say, you know, we're not going to put something out there with questions unless we're prepared to respond in a way that either implements suggestions that are made or really clearly communicates why certain things weren't made. Because I think that's honoring the code that we kind of have developed this system under, right? Which is, you know, nothing about us without us. So, and I, you know, I don't want to overuse that phrase, but we got to keep it right in the forefront all the time.
Thank you, Jonathan. Would it be helpful to, since the Appendix K was built on provider feedback, utilizing that in tandem with some of the discussions with the waiver work group to identify flexibilities? And I remember Easter Seals, Sue, I see your hand is up, coming out of the gate at the beginning with some very creative, like day program options for folks in the community. So I'd love to hear what you have to share.
I was just going to add that I know from the provider's perspective, the private provider network did send in a white paper feedback regarding providers, their collective kind of feedback on Appendix K, what was helpful, what should continue. So I don't know if that was reviewed, looked at. I'm not sure we've gotten a response. So I feel like we've submitted some feedback as providers, and maybe we should start there before we survey further.
Okay. So no survey. So we'll move on to the next slide, and we will take all the recommendations into account around bringing the provider white paper to the waiver work group, referencing the Appendix K, which, by the way, the provider white paper did contribute to the development of the Appendix K. And we went a step further as we were renewing our waiver applications to memorialize some of the Appendix K flexibilities into our waiver permanently. So I am very thankful for our provider feedback, and certainly couldn't have made those flexibilities without all of your suggestions. And I'm hearing it worked for a lot of providers. That I'm hearing that it was really, you know, helpful for folks, and people have been able to really push it to be creative and to continue meeting people's needs as best they can in the community. So are there any questions about the waiver work group? Because we're gonna give a quick update on the rate setting vendor real quick. If not, okay, we'll keep going. So we are working to select a rate expert of rate setting vendor very soon. This rate vendor will likely begin working with the state. We're looking at probably January or February, depending on the timeline for procurement. We do have to get the contract scope built out and have that go to GNC for approval. So the rate vendor has been identified. We're working to develop that contract scope. So in the early calendar year of 2022, we are going to reinstate our rate work group, and that vendor will be front and center working with the team to make discussion or to discuss how to move forward. Jonathan's question, am I able to receive or to share how many proposals were received? I'm not able to talk about the procurement process until after we've secured the contractor, but we can certainly do that after, Jonathan, after we finalize the procurement process. So next slide. The assessment tool review and plan next steps. So we sent out some reading material, albeit much of it was outdated according to you know, what was available to us for materials really, and some of the feedback that we received from this group outside of today's meeting. So last month we talked about announcing that the state's going to work with Aaidd to gather information, and how we're going to use that information is built out in this graphic here. So the goal is to get an assessment that's going to help the state understand the needs based on how the SIS is implemented. We're going to collect provider cost data. BDS and the waiver work group will develop service tiers to refine service definitions. The rate vendor, BDS, and the work group will work to develop a rate methodology, which will feed into the waiver application and any changes that are made. So that's a really kind of high level view of how we see this process happening. And I'm hoping this answers some questions around kind of the role of the work group. And of course, the steering committee will be receiving updates as we move through this process. The sample data, the goal is to use the sample data to connect what people need to how much money is spent. And we need to start somewhere. And so our goal is to get this sample set of data, provide it to the rate work group, and use it as a tool to build out the rate methodology. Let's spend some time on this slide and answer any questions that folks have. I see a hand with Carrie.
Good morning. I just wanted to follow up because at our last meeting, when it was talked about that Aaidd was going to be involved, we had a question on the table about our current state SIS evaluators being involved. So are we still, even though we have people within the state working on this through CISNY, are we still going to bring in Aaidd?
Yeah, so the goal is to have Aaidd provide support to the existing system now. So we're not going to get in the way of the process of people going through their SIS assessments. It will be more supplemental. And there certainly is an appetite to kind of leverage the work that Aaidd is doing to try to support the work that we're already doing in New Hampshire. The goal isn't to get in the way of it or to supplant it. It's to really supplement the work that's already happening.
And I just recalled at our last meeting too, we were concerned of burdening our families with this process. And I, just because to do a full interview, you know, you have to schedule a day off of work, and to provide these samples, and forgive me if I'm just not seeing it, you know, how are we going to help support families if we're asking them to take part in this process? Are we going to supplement or give stipends to them to participate because they are taking an extra day off of work to kind of help us out in this process?
So the SIS assessments are required every 5 years in order to be eligible for waiver services. So that's the goal, is to try to build on the existing system that's already there. People are already going through SIS assessments, whether it's their 5-year review, whether they have a clinical change that requires a new SIS assessment. So it's a process that's already happening. So we don't see it as, I mean, certainly if somebody had a SIS assessment done for their 5-year annual review, and then we scheduled another one the following week, that would clearly be a burden. So we would avoid doing that. We would take a look at who is due for their assessment, who, you know, we're going to work with CSNI, and Jonathan and I had an opportunity to meet after last meeting to see, you know, how we can be in the least disruptive way and really maximize this effort. And how could existing SIS assessors even benefit from this process? Maybe we could do it side by side and really collaborate. So there's an appetite for that. Certainly we don't want to burden people with extra requirements. Sue has her, or sorry, Kathy, you had your hand up next.
Sandy, you know, I'm well aware that you're just a soldier here, and I'm kind of feeling a little bad because
that scares me when you say that, because I feel like
you are.
I'm going to get a shot at me.
Yeah, you are not in the position of the decision-making authority. You are just facilitating this meeting, and I feel bad that you're bearing the brunt of some very challenging questions, but we were all seated on this committee for a reason, and everybody knew who we were. So
yeah,
absolutely. For, right? This goes back again. What exactly are we asking to steer? I mean, here, BDS announced a vendor. You've set up a process. What are we steering? This is stuff, I've been on steering committees. This is stuff a steering committee generates. Here's what we want to do, because we're clear on what the goal is. And here's the data we need. And here's, you know, who we want to do it and how we want it. And you've got a process all set up. You're telling us to you know, support these decisions that have already been made. This, you know, in this block diagram, is, you know, tiered waivers. You know, when did this steering committee say we thought that was a good idea? And it's just, it's frustrating. I just, maybe we change the name of the committee, you know, to the drive along committee, you know, because the fact that these decisions are being made without us in this system, like Jonathan said, nothing about us without us. We're not used to this. And it's very difficult to sit by and see, oh, when was that decision made? Who made it? And that's why it goes back to my original questions. Whose idea is this? Why are we doing it? And what is the goal? And it's just, I need answers to that, just so you can kick that up the food chain, Sandy. I need answers to that, because this is very frustrating to sit here and be asked, you know, to support a process that's been decided independent of us on this supposedly steering committee. So that's just my 2 cents.
Thank you. And Kathy, your feedback is always very important. And I think hard questions are going to get us where we need to be at the end of the day, because we need to consider all of the angles from every perspective. And so I do appreciate your feedback, and never do I want you to hold back. So those are all very good points. And there's certainly, as part of the rate work group and the rate methodology development and the vendor that's come into the state of New Hampshire, there are multiple assessments that are available for potential rate determination that are available across the country. And I think that there's absolutely an appetite for discussion in that future state of our state of New Hampshire. the SIS assessment has been around for a long time in New Hampshire. We have a long history of using the supports and intensity scale for service planning. The recommendations that were identified in the report really highlighted the importance of using a nationally normed standardized assessment to improve the equity in resource access across the state, right? So that's that scatter graph that everybody looked at and said, you know, we have to be able to align the level of service needed with the rate that they're receiving, and we have to get there somewhere. And with New Hampshire having the long history of the SIS, we've you know, given the community's standing familiarity with the tool, we decided to use it in the initial rate development work instead of introducing a new tool to the community. But that does not mean that long-term, there's no possibility of changing our assessment based on what we learned through this process.
Can I just
I know it's
follow
not
up?
ideal, but it's what we have.
Can I just follow up real quick?
Yeah.
At any point in this is an important question, and you may not be able to answer it, okay? But another one we need an answer to. At any point during this process, can this steering committee say, no, that's not a good idea. We don't recommend doing that. And will it be listened to? Because that's what a steering committee does. So I know you can't answer it, but is there room in any of this process for this steering committee to listen, to read, to consider, to debate, and go, no? That's my question.
Nothing is stopping members of the steering committee from sharing their opinion and disagreeing and saying yes, no, maybe. All of the
But will it be
feedback
listened
from
to?
every
Will
member
it
is
be
welcome.
listened to? Will it be listened to?
Well, and I mean, that's the purpose of having these meetings, is to listen to the feedback.
Is there
And so,
decision-making authority on this committee?
wait, sorry, what?
Is there decision-making authority on this committee of any kind?
Well, when we first went through the graphic, and I don't have it accessible to pull it up, we drew out the work groups, the steering committee, and how the steering committee will inform BDS, and then BDS will make the final decision on how to move forward. So I mean, we talked about that when Nancy did the first informational session, and we can certainly move, you know, share that again at the next informational session and take back any questions that you have for more clarification. But it sounds like we do need to write this down and provide some answers.
Thanks, Sandy.
Okay. Sue?
Can you hear me?
Yes, thank you.
Sorry, I'm trying to unmute. So I just wanted to just ask a couple of questions and clarify. So I know that we've been doing the SIS for, I don't even know how many years. I think I saw something from Jonathan that we have 10,000 SIS interviews already conducted. I believe that assessment from the SIS to the current spend was already done. It seemed like there wasn't like a lot of correlation. I think when I asked the data for the supplemental questions for medical and behavioral weren't included in that, which really does drive need. And I think we talked about SIS with supplemental questions might be a potential solution, but looking at those supplemental questions and how that gets factored into the raw score. So I guess I just wonder, like doing another sample without trying to figure out those supplemental questions, how does that factor into the whole score? How will that be any different than what we've already done?
If it would be helpful, Cindy, I can maybe jump in there and see. I think I'm following you there, Sue. So you're right. So when we had done our data request to DDS, we got access to the raw scores of the SIS. You know, Jonathan's comments and last time, as well as the comments in the chat here. The supplemental questions have been used. We did not have access to them at the time, and so when we think about it from that scatter plot, right? If we keep all things equal, is that base input of data, the raw scores of the SIS, and we're looking at all things equal, then yes, we could get more refined if we were to go back and pull the supplemental questions in. I think the risk here, and I'm just going to put it out, this is my opinion of what the risk here is anytime you go and use data, especially assessment data, in my opinion, that was not collected for the intent of setting rates. The first thing that we tend to see is people raise their hands and say, that's wrong because that's not why we collected it. We collected that data for planning, we collected that data for other reasons. And so I think the goal here of using a new sample and quote unquote clean data, right? This is the distinct intent of why we're collecting this data is important in the process, right? We want everybody to know that we're not trying to go and do a square peg in a round hole and use data that was not intended for this purpose to do something different. And so I agree. I mean, pulling in the supplemental questions, doing some, iterative analysis with some of that additional data that Jonathan has mentioned to refine this as we go into, kind of that rate setting process, I think is important. I think that could be really valuable information to this group to be able to bring to this group and dive a little bit deeper, especially hearing, Kathy's idea around how do we get access to additional data. So I think there's opportunity to leverage that and to work with CSNI in the work that they've done and go a little bit deeper there. But I think that's the intent of this sample, is to really just go in and all acknowledge that this is the intent of that data versus using data that was not intended for this to do something different.
Can I just ask a response? So you're saying that the assessments were done for the purpose of assessing people's needs, for planning, for service delivery, and there might be a different outcome if the intent is rate setting? Like, that just doesn't make any sense to me.
No, so I'm not saying that the results from person A would change from assessment 1 to assessment 2 necessarily. What I'm saying is, in my experience, when we've talked to stakeholders about using data in this process, there's been a lot of pushback of saying those assessments were not collected for rate setting purposes. And so what we don't want to do, right, is we don't want to say that we're going to use assessments that were collected for something else to accomplish something different. I think they've been used tremendously well, and Jonathan's team has done great work collecting a lot of SIS assessments for planning, right? And that was the intent of collecting those when families sat down with their case managers or their service coordinators and their support team. That was the intent of going through that interview. This is intended for something different. And so I think, for transparency purposes, acknowledging that and just making sure that we're separating that data and not trying to use other data to accomplish this task is important. I don't know that the results will change, right? That's a study that we could all collectively do and say, do we see the exact same from point 1 to point 2 for some of these assessments? But I think this is all around just saying, let's make sure that we're putting these into the right bucket. And so, Jonathan, I do see you. Can you clarify how that would not create a biased data set? So, sure. So the intent of bringing in a third-party interviewing group, right, is to try to ensure that that bias does not get inputted, right? So if you're going to go sit down in an interview process and ask people to complete an assessment for tied to dollars, that's the concern, right, is that there might be some modifications in scoring. It's an issue that the state, if the state continues to use an assessment for rate development, is going to have to continue to battle, right? I think that there is always that potential that as you start to make this connection of assessment to rates, that there's always the perception or the potential for perceived bias. And so it is going to be a challenge, right? It's going to be something we have to be acknowledging. The difference here is this sample is being created to start to look at the rates, right? The output of these 400 interviews is not going to necessarily drive any changes in somebody's budget. So it reduces, in my opinion, some of the potential bias, and was really meant to be used as an input into looking at the different data to guide rates. I think the other piece of this is too, how does DDS work with CSNI and looking at assessments that were already coming up for review, and that might be a way to reduce some of that bias as well.
We have a lot of questions. Krista, I'm going to start with you.
Thank you. So Jonathan's question actually gets to my question. So as a family member, thinking about an outside agency coming in to do the SIS. That was a concern that I had in terms of trying to gather data and asking those questions and thinking about trying to get accurate information. You know, an unknown person or persons going to different areas of the state, trying to capture accurate information in a culturally appropriate way. I wonder if they're going to be able to actually get accurate information. You know, Drew, you were thinking about, you know, is that going to be unbiased information? Is it going to be accurate information? And, you know, I question whether the information is actually going to be accurate, you know, if they're going to be able to get that, you know. So that's a concern that I have as a family member. And, you know, the other thing is, you know, I think you said something, maybe you didn't use these words, but like, it almost sounds like you're trying to take like the human component out of it. And as a family member, that's very concerning to me because we're dealing with people.
Yeah, let me clarify just if that did seem to come across. So that's not the intent. I think the graphic on the screen is to try to kind of get to that a little bit more, right? The SIS is an input into the process, but should not be the entire process, right? I mean, the SIS data, how it's been used now with case management around being a basis to have some of those conversations and really go through that individual support plan development. I mean, our intent is not to take that human process out of this. And so if I gave that if it seemed like that's what I was saying, I want to make sure to clarify that is not the intent here. But thank you for flagging it, Krista. I think, you know, keeping an eye on how families are going to be responding to this is very important.
Yes, absolutely. Jonathan.
Hi, so I just wanted to ask a quick question about the SIS then. Are you planning to modify or add additional questions? And I just sort of say this because the SIS was designed to support service planning. That's really what it's there for. And, you know, it does not measure the key factors that drive budget decisions, which is, you know, the support needs and the availability of natural supports. And the delta between those two is where really the budget comes in, because then you need to have paid supports. So in addition to eMods and other, you know, other things to help support daily living. So I guess my question is, how are we going to fold in to this analysis the real life circumstances that people are presenting in terms of measuring their budget needs?
I think that's a really good question. I think it's for the rate group. That's a good, I mean, you're on the rate group, right, Jonathan? Well, I mean, Ellen will be.
Right.
So, you know, I think that is a very legitimate question that we can try to cover when we start building out the rate methodology. If there are gaps, how do we cover those gaps?
Right.
Sorry, Drew, I didn't mean to talk over you.
No, it's exactly right. And I know we talked a little bit about it with this group last time around. How are we going to be thinking about measuring natural supports? And, you know, do you do that through the assessment, and what are the risks or benefits of that versus do you address it through that rate setting structure? And so I think you're hitting the right points, Jonathan, and I think we should keep coming back to it. Really, what is that trigger of when does somebody need paid and some of the supports, and beyond just the rates and the assessment tool, but how do we think about charting the life course in that process? And so I think that's where this opportunity is, right? I think we're asking a lot of those key questions of what triggers these reactions and what are the different ways that we can kind of build in some of those structures to help support understanding it better.
So I guess I'm just sort of saying from my perspective, I guess if I was trying to design this, you know, and I looked at what I had already for data on the SIS scores and budgets, I'd try to take, like, you know, maybe some qualitative measuring here, like maybe 25 circumstances where you have two people with identical scores and totally different budgets, and talk to them and say, you know, help me understand what the difference is here, you know. Because then the next piece of development is how do you refine that? It's at a very granular level, but it might be really worthwhile to consider.
Yeah, I think it's a really good idea.
Here, Denise, you've had your hand up for a while. Sorry.
So, Drew, I just have a problem with this whole SIS being utilized to even a smidge from a rate setting perspective. The gosh darn thing hasn't been updated since 2015, which already puts it behind the 8 ball. And it's not normalized at all. Again, to echo Jonathan, it's, you know, it's just an assessment, behavioral and medical. And so I have a problem with that because there's no annual reassessment. So when you start utilizing something that is, you know, so many years old to bring it to the, you know, to 2022, it's just problematic for me. I can't see what components of it are going to be, used from a rate setting perspective. I mean, if something is to assess an individual, how do you translate that? It's like physical therapy, the 15 minutes and the, all of that. And how many services have to be done during those 15 minutes.
Yeah.
So I'm having a really hard problem, because the other thing is that it doesn't, lead itself across multiple populations. So it's not the end all to the end all. It's a piece, it's a cog in the wheel, but, and I guess the rate setting vendor, whoever that is. So that's pretty much it. Just having a really hard
Denise,
time.
I love your questions. You've raised some really amazing questions last time as well, so I do appreciate it. So I do want one point of clarification. So the SIS has been normed. Sections 3A and 3B, exceptional behavioral and medical supports, are the only 2 sections of the SIS itself that have not been normed. The supplemental questions have also not been normed, but the rest of the tool has been. So I just want to level set there that has occurred. It's been done, it's been well documented, it's been well studied. As far as reassessment, so you're right. I mean, the recommendations from Aaidd are typically to reassess every 3 to 5 years. In New Hampshire, that's currently happening every 5 years. Now, there's also another step in that process, right? So the SIS recommends that anytime there's a significant life change for someone, that a new SIS assessment occurs. So naturally, we would all ask, but what's a significant life change? And I think that's what the state can work to define, to say what would trigger that to happen, right? Where do we see that there would be value out of having another assessment? Because they're long, right? They're 3 hours, sometimes more, that these assessments are taking up in people's lives. And so we would want to be mindful of that, but also, agile enough to really be responsive to people's lives. And so I think, that's a piece of it. The other piece of it, and we've talked around it, and I think, again, thinking about the role of this group, where there's going to be a lot of value added from this group, is what happens, and I think this is kind of what Jonathan was getting into as well in his comment, what happens if somebody just doesn't fit into this quote unquote model, right? What if the assessment just isn't working for Drew or for Sandy or for Jonathan, for one of us, right? We're not working into that model with the rates and the constructs. What does it look like for someone to raise their hand and say that, right? What's that exceptions process, which I think we've talked around but not defined. And I think there's going to be a lot of work and a lot of time that should be put into that to make sure that if we're going to go down this path, we have a way so people don't fall through the cracks, right? That's my biggest concern, just to lay it out there for this group, is people who, if you think about levels, who bump up close to the next level but don't quite get there. That's where I'm the most concerned, is what's the process for them to make sure that they're getting what they need, right? And so that's where that exceptions process is going to be very critical. And I think we should spend a lot of time on to hopefully get to some of your points, Denise. Related to not working across multiple populations, you're right? Like I'm not going to try to sell that the SIS can work across multiple populations in its current iteration except for there's a version for kids and there's a version for adults. There's not a version for behavioral health. There's not a version for aging. So there are limitations there, which we flagged in that report that we did of, the only other tool that crosses those boundaries currently that's a little bit more updated is the NRI. It's different though, right? I mean, it's got its benefits and it's got its drawbacks, and we'd probably be having a very similar conversation about that tool as we are about the SIS, right? There's no silver bullet in assessments. There's no silver bullet in assessments for ISPs, for the HRST has its flaws, but it does a generally okay job for identifying health issues. There's none of these assessments can be perfect to really understand somebody's entire life. So we need to think about what are the other structures in place to fill in those gaps.
So Drew, going back to what Jonathan said, are you at some point, I know you probably can't answer this now, but at some point, is there going to be, a side-by-side comparison of, like Jonathan said, of two individuals that have the exact same score, but they're definitely very different in their needs? Or is there going to be that sort of comparison so that the budgets can have, some sort of, factor, because, when you look at BRGs, it's n to the 9th power times 2. I'm just kidding.
Right,
but
I know. No, what we would typically recommend is, as this rate process continues on the path, and as we start to think about this exact piece, right, of differences of people, we would ask the state to consider doing a clinical file review, right? So pulling files and doing a deep dive on kind of the case notes for somebody and better understanding those differences of people in different levels, right? So yes, I think there's that. I think what I'm hearing from this group is maybe trying to do that a little bit sooner, not necessarily from a clinical perspective per se, right, but from a educational perspective. So we're all thinking about this differently, about how different assessment scores or people might be having the same assessment scores. So to the bigger piece around using it to validate the model and to make sure that we're looking from that clinical case review, 100% yes, to a more, a quicker or coming up a little bit sooner review of people who might have similar SIS results, then yeah, I think that would be a great exercise. I think we would just have to be very mindful of, people that we're selecting, that we're being mindful of their rights and thinking about, how are we going to protect their information as well, and do this in a very de-identified way. So I do think that that's definitely an opportunity. Jonathan, I appreciate you raising it. I do think it's a good opportunity for the team to just kind of talk about this more about direct people, right? And not about the idea.
And Carrie, we have your hand raised. Go ahead, Carrie.
Yes, thank you. So I have several questions, actually. First one is just a housekeeping question with transparency. There's a lot of really great comments in the chat. Are those folks that are watching the webinar, are they able to see those comments? There's some really great discussion happening in the chat, and I didn't know if the folks watching are able to see those or not. And if not, are they going into the notes?
I believe that everyone is able to see the chat. And I also believe that people who are not panelists and just attendees can type into the chat themselves.
Okay, great. I just wanted to ask that.
And just to verify, Carrie, I am capturing them.
Okay, great.
In the notes.
Thank you. Oh, and somebody wrote, we can. Okay, great. I just wanted to make sure that everyone could participate. So my 3 questions are, 1, what is the cost of bringing Aaidd into the mix? How much are we going to be paying them, or what is the budget for including them in the process?
So can I get back to you on that one, Carrie? I'm not sure if I can reveal that since we're under procurement at this time, but certainly can follow up on that question.
Thank you. And
yes.
The other question that I had is kind of going back to, I believe, what Krista had said and Denise had said about the comfort level of families. And when I'd asked the question before about the SIS and not overburdening families. We were saying, and it says on this slide, that people participating in the sample will not have changes in their service tiers or budgets. So that to me is saying that they're going to have a separate, if they're in the sample, then this isn't their real SIS assessment. Is that what I'm gathering from that they will actually be doubled up on? One will be their real assessment for services, and then the other will be with Aaidd, as it says. This sample will not have changes to their service tiers or budgets. Am I reading that correctly?
So I think it might just be a nuance. I think you've raised a good point, Karen. We might want to clarify this. So the intent is not to double up, right? So the intent would be that if Aaidd conducts an assessment, then that data can be shared with the case management team so that they can use that in planning. I think what we're trying to say here is kind of this conversation we were having with Jonathan, that this sample is not intended to replace what they're currently doing, right? So it's not going to drive to them getting different rates or new rates of what's being built, right? So the data can be used. We're collecting this data to go into that rate setting process, but this data could also be used and given over to the case management team so that they're not conducting two SIS assessments.
Mm-hmm. And I wanted to also add to what Krista was saying. So I know for many of us families, parents and individuals that have been receiving services for a long time, there's people we've worked with for many years and we're comfortable with and know our situation and we can bare our soul with and feel very comfortable. I am worried that there's going to be folks that will not want to participate or feel comfortable participating in the other sample. So what will our process be for those families who wish to opt out? And I am also concerned of what Jonathan had said about it being a biased sample, because I know families, it might be harder for them to be as honest, to be as forthright and not honest, but as an open book with a stranger than with somebody they've worked with in the past. So I just wanted to put that out there a little bit.
So that's some good feedback on how we build out the sample assessment. And I think that there's room for discussion about how that will be operationalized, and those are all very good points.
And forgive me, I had one more comment. This was about the rate setting. And I know I am by no means a rate setting expert at all whatsoever, but I know we've had over the years, we had a separate group working on rate setting. So we have a lot of experts within our state, and I know we already have it out there that we're looking for a rate setting expert, but why did we choose to go outside of the network of professionals and amazing dedicated folks that we already have within the state?
So we're currently under a procurement process for a rate setting vendor, and that is a very distinct function. And we receive, so through the procurement process, agencies submit proposals. They could be from any state, really. So it depends on what proposals are submitted to the state and what fits into that criteria, really.
I would just add, and so you're exactly right? And so that's the intent of having, I think we've got the rate setting work group. There will probably be additional voices that need to be in that process. There's a lot of experience in the state of how services operate that's going to be really important into that rate setting structure. The difference is, there are rate setters who this is their job. So as much as everybody here has a lot of input, you all also have jobs, right? So sitting down and trying to build the rates and make sure that those are going to be approved by CMS and are accounting for all kinds of nuances within the rate development. I think that's the value of a state getting a rate setter to come in and help with that, is to collect all of that great information from those different groups who have been participating in this, from area agencies who operate and private providers who operate and families who want to see services provided in certain ways, and then take all that and say, okay, how do we build now an actuarial sound rate that can meet what CMS requires so that we are getting that reimbursed at what the state needs to continue to pay for services, and that it truly does cover the cost of service for providers. And so that takes a lot of time. It takes a big team to do that. And so I think it's additional resource to kind of help support what you guys have been doing.
And Drew and Sandy, I just wanted to, in closing, just add to that, that I do think that the folks within the state of New Hampshire that have been working on a separate rate setting committee, I believe is part of the corrective action plan, that we need to really make sure that they are heavily included in this process, because they do know the state and the families we serve in and out. And I guess I do understand the importance of having an objective person that is their primary function, but this just goes along to what many people are saying, that there is a nuance to all of this, that the state of New Hampshire is not like other states, that our families are not, and our needs are not like other states and other families' needs. And I just want to make sure that we are always recognizing the talent and the scope of information we have from the folks that live and work within the system in New Hampshire, and we're recognizing them and recognizing those nuances. Just wanted to put that out there.
Great, thank you. Deb.
Yeah, so Carrie really said what I'm going to say. So, you know, Drew, as a provider to this population, every single provider in the provider network will be happy to set time aside to be part of this process. And I'm speaking as an agency that is closing a program on December 31st because of the rate setting. So to think, while we recognize that, yes, our time is busy, there's not going to be one provider in the provider network that is not going to be willing to set aside any amount of time that is needed to ensure the fiscal viability of this program. So I do take a little bit of offense to that, because this is something that we stay in and remain in because of what we do and who we serve. So Carrie, thank you for putting that out there, but I'm just, as a provider, going to state that purpose.
Yeah, so let me just clarify there, Deb, because I think I might have said something that was taken out of, not how I intended it. So I 100% agree, and I think you should be there, and I think providers should have their CFOs there with them and making sure that these rates work, because it is going to be different, right? There's going to be collecting cost data and really working through what, you know, admin structures and all those very important pieces to support your programs. My only point was, you know, giving all that input and then letting the rate setters go and do the math on the back end so that you guys can continue to operate programs, but be very actively engaged in that process. So I apologize if I gave the assumption that I didn't think you would want to be. I do know that you should be and will want to be, but that was what we were saying, is leveraging those resources of a rate setter to, you know, take all of that information, put it into a rate structure to then bring back to you instead of spending the time building the rates yourselves, I think was my intent.
Thank you.
Lisa.
Thank you. Probably at this point, almost 15 minutes ago, Drew and I'm not sure who else referenced being able to respond to the changing needs of individuals who have budgets, changing service needs, etc. Our current reality is that we have hundreds and hundreds of individuals whose lives have changed over the decades, and their access to budgets and increased budgets or different services has been impossible. It is an extraordinary expectation of the DD, CFI, and ABD communities to expect that we're going to go from the state of non-response to changing service needs, that somehow this system is going to miraculously fix what has left people in many cases without services and deeply isolated. Can you speak to this a little bit? Because it seems an extraordinarily incredulous thing to assert will be fixed.
So yes, right. And Sandy will tell you that this is probably what I spend the most of my time talking to her about. So I think this is the bottleneck, not on the fault of BDS, but just in process wise, right? Getting those PAs processed in a way that releases the resources so people can get what they need is the bottleneck in this system, right? That's got to get fixed. And so where I think there's an opportunity here, and I'm not going to try to pretend like this is going to happen in 6 months, right? This is the cap, this is direct bill, this is IT builds, this is the waiver and the rates and the flexibilities that come with those. So it's going to take time. But what I think happens at the end of this is the investments that the state is making, primarily on the IT side, but as well on the rate side and the ability to kind of have services change. I'll talk about that in a second. But the IT build should correct a significant component of that. That's my hope. That's what I'm driving to. I'm being a squeaky wheel in that to make sure that when somebody is asking for a change, it should not be a red tape process that takes a long time to get through. So as an example of this, typically if I were receiving services, right, and let's say I'm getting rehabilitation currently, and I want to now have employment services for half of my day, right? Not on my plan, but I want to change my plan to get access to those. That process should just be a pretty straightforward plan change, right? I'm mid-year, I've already done my level of care, I've already had my SIS assessment, I know what my budget is. This might modify my budget a little bit, but it should be pretty straightforward to meet with my case manager and say, for the next 6 months, I want to add this service into my ISP and get that authorized. Under current structures, right, that can't happen easily for a person, and that gets bottlenecked and that PA gets stuck, right? With the IT infrastructure, I think we'll see 75% of that issue. Don't quote me on that yet because it's still very early in the process, but a big majority of that gets solved, right? Using technology versus paper process should help in that because it allows information to just flow more naturally and more easily. The other piece of this, right, is we're going to have to be thinking about how does someone think about the structure of the service agreement and the individual support plan structure, and how do we make sure that that also meets their needs, right, of measuring their goals and their opportunities and what they want to accomplish and the services that they want to access. But how do we use that of what's currently there in that service agreement that's working really well and identify where we can make changes in the process if they're needed so that that information can move more easily. So I agree with you, Lisa, that one of my biggest challenges with when we came to look at the system is exactly that. Is
But
that
Drew,
when someone, yeah.
with all due respect, if somebody currently in the system wants to mid-year change to employment services, they can be told yes on paper, in some places more easily than others, but then you need a vendor to provide the employment services, and you need the money you need the extra money, and you need the staff. You not only need a vendor of employment services, but they have to have staff, and then the budget has to be adjusted up. And there are people who, had budgets for DSP support that's 10, 15, 20 years old, where they would have 20 hours a week of community-based engagement, but they can no longer afford a DSP to provide 10 or 20 or 30 hours a week, because what DSPs were paid 20 years ago is not what they're being paid now, or maybe it is actually, but I mean, it's I can appreciate your enthusiasm for thinking that IT is going to fix some of the service snafus, but that is,
there are other pieces.
I
get you, right?
There are multiple other elements, and I think that it's.
You're not. I agree with you, right? You're not wrong, and I don't want to downplay those other pieces. I think when we were talking about what helps this process, I do think that IT is a big piece of that, right? Modernizing that structure should help information flow. The other piece of this, right, as we think about rates, and part of the conversation that we've been having with the waiver group is thinking about provider qualifications, DSP qualifications, DSP credentialing, is how do we use this rate schedule, this rate setting process that is meant to be built off of DSP wages to stabilize the workforce, so that other piece of the issue, right? So if we can release the funds, that's half of it. But if you have the money but can't buy anything, then it doesn't get you any further down the road, right? So how do we use the rate schedule to ensure that we're updating DSP wages so that we're covering the cost for providers, so that hopefully the network feels like it's less tied to an antiquated rate schedule, but it can now start to grow and kind of build out a little bit more. Hopefully that solves part of the other issue. I'm not going to pretend, right, like we're going to solve collectively here the DSP workforce issue that's been happening for 30 years with just these two pieces. But hopefully it starts to move us in that right direction. So I agree. IT is not all of this. That process is not the only piece of this. But I think, I think we're trying to think about it as that whole of both sides of how do we open up the access to resource, but then how do we also support agencies to rebuild some of that infrastructure and really be thoughtful of the staffing side, especially.
Carrie, you have your hand up next. Thank you.
And I have a question that may have already been answered way at the beginning, but I'm just not remembering. As part of our work on the steering committee, and I think that's one of the reasons why I asked the question about what is the cost of bringing in Aaidd, is part of our work on the steering committee to make decisions about how much we are spending on all of this entire process of the BDS redesign. Do we give feedback on costs or ways to cut costs as we go through the, just the process? Are you looking for that kind of input, or is that not within our scope?
So that's not within our scope at this point. We have resources available to us that I would prefer to take advantage of. So there's nothing on the table in terms of like, here are dollars that we can, either accept or not accept as a steering committee. So that's not part of this agenda, but I understand why you're asking that, and I do appreciate it. Thank you. Jonathan.
Thanks, Sandy. Just coming back to Drew's example about employment supports, like somebody who needs access to employment supports and the PA backup. I mean, we have had processes built in that have kind of been stripped back out for giving the area agencies the capacity to sort of flexibly address those needs. And I don't know if Drew's been sort of filled in on some of the history of that, but this is an opportunity to sort of say, how do we maximize or optimize the flexibility of the system to meet people's needs in a timely manner, especially given, I think, really a very clear and honest admission that a lot of times the bottleneck is that we don't have enough people to process all the change requests and the prior authorizations that come into BDS in a timely way to meet, so that people don't end up feeling frustrated, or the opportunity to hire somebody isn't overly delayed. So one of the things that we really, I think, need to just keep looking at through this whole process is how many people do we have involved that are willing to help if we have some flexibility, right? We've got 10 area agencies, 45 other vendors, and we have hundreds, if not thousands, of families doing in PDMS, and we have thousands of other families in traditional services. Like, I think that there's a lot of great brain power to help create some solutions, and a lot of them have been created, but they've been kind of taken back, either because of the changes with CMS or whatnot. So it might be worth taking a look at some of the things that we've had to lose and say, how do we build them back in?
Excellent points, Jonathan. Thank you. And I'd like to just start moving forward because we do have a few more slides that we want to go over before noon. But I do want to recognize comments in the chat. So Ann Petozak, yes, we will have access to the slides. They'll be posted on our website. I think, Jonathan, we addressed the comments about the CIS in the chat. Stephanie made a comment around thinking that it's a mistake to say that the data won't be used to impact budgets. Seems clear that there won't be a direct, it seems clear that there won't be a direct impact. For example, your budget is being reduced because of your answers on the CIS, right? However, results of this data will have significant impacts on those budgets and the budgets of everyone in the system moving forward if you are creating rate bands, etc., based on scores. Isadora says that she likes Jonathan's suggestion, essential to understand nuances related to paid support needs. So Mart recommended or suggested, would BDS consider creating a subcommittee of the rate setting group to do a deep dive? This group could include people familiar with the CIS. You know, I'd go a step further, Mark, and say it could also include Aaidd, who created the CIS, you know, and we could poke holes in it with them and see how that might work. So yeah, we're open to considering any further investigation to help us, you know, get on a path that's fully informed. So that's a great recommendation. All right, so Stephanie, Patrick, that doesn't make any sense. So this is probably in context of the conversation we were having. Are the results of the Aaidd surveys going to be used to develop/influence ISP budgets or not? I think that needs to be made clear to families. You know, I think I'm just going to take this real quick and say that the CIS assessments do inform person-centered planning, and the health risk screening tool informs, and additionally, any other assessments are used to build the individualized budgets today. So I don't think that that's absolutely out of the question. Individualized budgets are built based on an individual's needs, which are determined through a number of assessments, including the CIS. So it's like Drew said, the CIS isn't the end all be all, but it is part of the process. We have not already contracted with Aaidd, Jonathan. That is in procurement process now. Kathy, I don't know the answer to that. If the CIS assessments are going to be both virtual and in person, I mean, the virtual option is to, you know, basically be flexible around COVID. So I think if we need it, we can move to that if we need it. Will families be notified when they schedule a CIS and that it's an Aaidd versus a CSNI reviewer? So that's, I mean, that's a good recommendation in terms of how we operationalize it, Lisa. I don't see a problem with that. I know that CISNY had contracted with Aaidd in the past, so I'm not sure if there's a precedent there in terms of whether or not people were notified. But I can look further into that for you. And Lisa, you had another question. Did you already answer it?
I asked it, thank you.
Okay, okay. Yes, the Aaidd interviews will be trained. And I'm trying to get through these quickly, guys, because I want to keep moving on. Given all the questions that need answers, should we have more frequent steering committee meetings? The decisions that are being made are going to affect the lives of New Hampshire citizens, potentially for decades. I believe that the steering committee would endeavor to make time if key questions. So, so Karen Blake is recommending that we have more frequent steering committee meetings. Stephanie says IT is probably a problem, but not the biggest problem we could see. Also before the meeting ends and we don't reach the end, right? I mean, I think we need to keep moving on, and we will take questions back and try to answer all the questions in our next meeting. I'm not opposed to having more frequent meetings if that's something that the team would like to do.
Sandy, I just want to throw this out real quick. One, I would agree because of the nature of today's meeting and the previous, that more meetings would be of benefit so we can get through some of this. And the other part is, if there's a way we can get this steering committee, the videos of the waiver commit, like I don't have all this time to sit. I try to watch them or listen when they're on, but if we could get those, it would just help me understand what you're showing me.
Sure.
And I would watch them ahead of time to be able to do a better, you know, I just don't feel I'm useful just reading your slide.
Gotcha.
Okay.
Okay. So these are the assessment tools that went out prior to today's meeting. The SIS supplemental questions, individual budget using the SIS scale, 10 issues for states to consider, analysis of budget methodologies, and the HRSI case for inclusion ranking analysis. That is a lot to review. Are there any comments or questions about the material that went out? I already heard your feedback, Kathy, around it being outdated. So that's been captured. So Kathy's got more to add. Go ahead, Kathy.
I just want to say that I had a few questions and they were in the emails that I sent. So again, I don't necessarily have to answer them today, but if everybody reads their emails, I had a couple of questions and I cited which document my questions related to.
Yep.
So rather than take the time to try to scramble and answer them now, which you probably cannot, if you can just refer to those, Sandy, and get us some answers to those.
Okay. All right, so we're going to move forward and go over the timeline review. So this is a much sought after and requested overview of the corrective action plan work that was streamlined with the work that's related to the BDS systems work. So we distributed that timeline to everybody on the committee, and we used information in order to make that timeline from two different places. We used the timeline and the milestones that were developed from the conflict of interest plan work group, as well as the timeline developed by A&M. And so I'm just going to be really clear and say, you know, with the corrective action plan, we built out a stakeholder group, and I think we started with 4 subcommittees, and that was merged down to 3 subcommittees, and we were meeting on a regular basis. And we did not want to have A&M work running parallel to corrective action plan work, because that would have equaled 2 large stakeholder committee meetings a month and like 6 subcommittees a month. And we didn't want to really overburden everybody with that level of stakeholder engagement. So the intention was to say, what in the A&M recommendation and report applies to the corrective action plan, and how do we roll that in? So the corrective action plan had 2 things. We need to make sure agencies are not in conflict, so that they are, area agencies are not providing direct support services and case management to the same individuals. That's one. The second one is that we had to move to direct bill and move from 10 area agencies that are Medicaid enrolled provider that are the only entities that are able to bill for waiver services, to allowing all providers of waiver services to bill for Medicaid, which led to a discussion about rates and how we build our rates and the designated area agency function, and lots of work with our subcommittees. So with A&M making a recommendation around rates and IT and ITS capacity and the waiver, the tiered waiver, we rolled the corrective action plan into those recommendations, and then built out the A&M recommendations that didn't fall into the corrective action plan as well. So now we're working on one timeline, and we're organizing our work in a way that is broken down into these 7 groups: quality and capacity, reimbursement rates, stakeholder engagement, intensive treatment services, IT modernization, waiver structure, and policy updates. These are the things that we want on our radar. We're going to move into a high-level view of the timeline. And you'll see it's color-coded on the left. You have quality and capacity, reimbursement rates. And so what we are trying to demonstrate here is a timeline. Again, this is a working draft, and it's not all encompassing of all of the work we're doing. We could drill down to any one of these boxes and probably have a whole slide deck on it. But we do want to just give everybody a high-level overview of the timeline. So I think what I'm going to do with our 10 minutes is ask for initial feedback. And I'm going to recommend that we dive deeper into the timeline in January, if that's okay with folks here. And of course, we'll take all the questions back, develop answers, and then in our next meeting, maybe consider a more frequent meeting schedule. And of course, Anne, your recommendation about posting the recordings.
Okay.
So everybody saw this and, you know, you received it in your email. Any thoughts, initial reactions? What do you guys think?
All right, I'll jump right in for you.
Okay.
I have a lot of questions.
I know you're comparing it to that calendar on your wall. And
Yeah, it is.
Yeah.
And I have to have my stickies in place, right?
Right.
So, I mean, it was, you know, it's helpful. This is helpful for a first stab at it. I don't have a problem complaints about it or anything. I just have a lot of questions that maybe drill down things to you, but I see them as more of probably should be a little more apparent on some kind of timeline as to what is really being looked at. So I don't know whether or not you want, I could take one of these and write my questions on it and then scan it in and send it up to you guys to look at, because you know, I think we've also just sent a letter up, CS&I, to you and Nancy and I think Chris with some other questions. You know, what again, which is, it still sits in my craw when conflict of interest started, and now when I'm looking at this, is that I'm not feeling confident that the provider of last resort, as a term which I hate, but it is real, okay? I can't find it. Like, I agree, through all of this, and you're gonna change rules, and you're gonna do this, and I still have a problem with the conflict of interest federal rule. I understand it, I agree with it. I think we do a good job in this state for choice, maybe not as great as we could. But when it comes to Friday at 3 o'clock, and I get a call, and then I get a call from the state that says, you've got to pick this up. I'm not seeing anywhere in this how that's going to get teased out. And that is huge. It's huge for all of these families. And you know, Sandy, you and I have spent many a Christmas on the phone.
Don't jinx us.
I know.
It's coming right up.
So I'm not going to belabor this.
Yeah.
Because we've sent some stuff to you, and and I have a lot of suggestions or maybe clarifications from you that, so that didn't have to be, but so just to give you that I do have feedback.
Okay. Thank you.
Yep.
Other initial thoughts? Jonathan, that's a real hand versus a cartoon hand.
I know, sorry, for some reason.
No,
my
it's good.
chat button instead of my raised hand. I've had way too much input today, I apologize.
No, it's great.
I would concur with Ann. I think having this laid out in a graphic format is sort of helpful to see where these processes are going to overlap. I know there's still a lot to build out, and you know, ITS being a really significant one, and it's just interesting that we're sort of having this discussion while simultaneously right now I've got John Finn in the other room doing a presentation to about 50 people, but you know, on how to do person-centered risk management and planning. So, but one of the things that I just want to sort of come back to is that you know, we're parking things like ITS. Well, we're parking ITS. I don't say things like it. Okay. And we have this sort of broad category of IT modernization here that don't yet really have any form. But those are the areas that we've really been talking about for the longest amount of time as a system that need to have build out. We don't, I mean, I don't think the area agencies certainly, and I'm just, representing conversations that I've had with folks, and I don't think this is a secret. I don't think anybody has seen yet the value in doing the tiered waivers. But we have immensely value, having systems that really talk to each other and that reduce effort and burden. We really value having capacity for high risk, high need, complex care situations where the vendors who are providing them are paid commensurate with the level of incredibly difficult work that goes on there, and the clinical services that are needed to be integrated with them. So, I think there, again, like just as we continue to roll this forward, I think the prioritization of these items and the level of operational detail that needs to be factored in to the things that we've been saying all along need to happen should take priority over the waiver redesign. That's just my opinion on that, but it's, I think if I'm reflecting what I've been listening to since I started at CS&I, it's IT and ITS and workforce. So those would be my priorities in how this timeline is built out.
Okay, great feedback, Jonathan. Thank you.
Sandy, I had a question.
Oh, hi, Carrie. Sorry, I missed you. Go ahead.
That's all right. I'm not shy. I'll speak up. No worries. So just to go back to, say, the State Family Support Council and my own Family Support Council, and I would, give them an update from this particular timeline overview. Would it be correct for me to say that if you as a family member want to give feedback about the waivers, you have until the end of April to do so? And because at that point, BDS is going to draft the waiver applications, or are you going to draft the waiver applications by the beginning of May? And then are you going to have listening sessions like we do typically with IHS and BDS with the waivers? And looking at this also, service coordination orientation in July, it says BDS will offer service coordinator training and stakeholders will provide feedback on the training. So are we going to provide feedback on the training before the service coordination orientation starts? I just was looking for coordination, clarification on both of those. I just want to make sure that when I'm going back to the various groups that I'm involved with and other parents, that I'm able to really, kind of give them a more nuts and bolts breakdown of how they can engage and give their feedback.
So I'm going to answer those questions and then we're going to have to wrap up. And I would like to ask everybody to please, if you have any unanswered questions, submit them to our email address and we'll get them documented and answered between now and our next meeting. But to answer your question, Carrie, about the waiver work, yes, we do have, every state is required to offer a stakeholder public comment period when they build a new waiver. So an engagement with families can happen as part of the waiver work group. It can happen anytime throughout this process. And then once the application is drafted, we go to public comment, and then there's another opportunity for stakeholders to weigh in at that time. So that should answer that question. And then in terms of the service coordinator orientation, we do recognize that moving from the way things used to be done into a new system with direct bill and with lots of things to consider, that will require bringing service coordinators up to speed on how to provide service coordination and how to support families. So this is kind of a trial run between July of 22 and December of 22, where we offer that orientation and then receive feedback. And then in 23, we will finalize it and move forward with it. So the goal is to engage our stakeholders in that process around the service coordinator orientation. My experience is that agencies have built out their own orientation modules, and so it varies from agency to agency. And we want to be able to give people the opportunity to weigh in, because we know that you guys are the area agencies, independent case management agencies, you know, they're the expert on service coordination. We certainly don't want to be the end all be all in that. So I'm going to thank everybody for your participation today. I know this is a lot, and your feedback is extremely valuable. Your time's valuable. So thank you for being here. And we're going to be summarizing all of the questions, coming up with answers as best we can, and we'll meet again in January. And between now and then, I hope everybody has an amazing holiday, a relaxing, amazing holiday. And thank you.
Andy, there's one more question in the chat, just about the last slide.
Yes, absolutely. This is all public. Thank you. All right. Have a great day, everybody.
Thanks, Andy.
Bye.